I want to tell you about a case where I was this close to missing a life-threatening diagnosis. So a few years ago, I was working the ER on a really busy evening shift. ER wait times were around 2 to 3 hours to be seen, and all of our beds were packed with sick patients. So I was doing my best to cycle patients into and out of a small assessment area where I could do a quick assessment, start investigations, and I would push them back into the waiting room so I could see more patients. And all of a sudden, an overhead announcement goes off saying that there's a code white in the waiting room. So I rush to the waiting room to see what's going on. And there's a guy that's in his 30s who's beat red in the face. He's sweating. He's really angry, yelling and screaming. And he's surrounded by four of our large security guards who are getting ready to grab him and take him down to the ground. And one of the security guards tells me that he's been verbally abusive and aggressive, and they're going to escort him out of the ER. And our hospital actually has a zero tolerance policy towards verbal abuse. And so there's a lot of pressure from staff members to have these people escorted out of the ER. But anyways, I decided to verbally de-escalate the situation. And I said to him, hey, I'm the doctor. I need you to calm down. Tell me what's going on. And he's really angry and upset, saying things like, oh, these fucking guys are harassing me and blah, blah, blah. And I tell him, hey, listen, ignore these guys. They don't exist. I need you to focus on me. Tell me what's going on. And so he tells me that he's been sitting in the waiting room for over 2 hours, vomiting into a bag repeatedly. And now he's developed chest pain and shortness of breath. And he just can't wait any longer because the pain is intolerable. And so I asked the security guards to escort him into the hallway beside triage, where I do a quick assessment and realize that this guy is completely covered in sweat and his abdomen is tense and he's moaning in pain when I touch it. When I listen to his chest, he has no air entry on his left side. So I sent him straight for a chest x-ray, and the chest x-ray shows that his left lung has completely collapsed and he has fluid in the chest cavity. And I'm thinking, man, this is weird, because his chief complaint for coming to the ER was nausea, vomiting, and diarrhea. So I put him into a monitored bed. I sedate him so that I can put in a surgical chest tube. And when I puncture through his chest wall, I get a big whoosh of air that just stinks like rotten, sour milk and vomit. And so I put in the chest tube and it immediately drains out brown vomitus. So I sent him for a CT scan. It confirms that he has a ruptured esophagus, or a rare condition, what we call Boerhaave syndrome. He gets taken to the operating room. They surgically repair his esophagus, and he gets admitted to the ICU for sepsis afterwards. But I think back to this case every time that someone tells me that they're going to be escorting a patient out of the ER for verbal abuse, because if I had let this guy go without assessing him, there is 100% chance he would have died. There's like no doubt he would have been dead. And so I think that this was kind of a perfect storm with bed blocking in the ER, long ER wait times, delayed investigations. And so I want to do a few videos on long ER wait times because it's very topical.